So, Alicia, your pregnancy test results are back, and it says negative. You're not pregnant.
Oh, good, good.
Okay. Tell me about that.
Well, I'm relieved to know that I'm not pregnant. I don't want to be pregnant, so what a relief.
Good.
Thank you.
You're welcome. You're welcome. So, can we take 5 more minutes and talk a bit more about where we go next?
Sure, as far as where I'm going next?
Yeah. I guess relieved, glad to not be pregnant. I'd like to hear more.
Absolutely. My plan is to go to college, go to California, do some acting. So pregnancy was not in the plan for me. So I'm just super relieved to know that I'm not pregnant.
So you look at your future, trip to California.
Oh, yes. To go out there and act or go to LA and just mingle and be footloose and fancy free.
Okay. So footloose and fancy free.
Yes.
Okay.
That's my plan.
Okay. Sounds like a good plan.
Yes.
I wish I could be footloose and fancy free. So one of the things that I guess I want to talk to you about is it said on your chart that there wasn't any history of using birth control.
No, well, I didn't really use any birth control. I've heard in the past that birth control pills, they make you fat and make your face fat and they distort your face and they make you break out. And I just never really wanted to deal with that.
Okay.
I just didn't really ever want to deal with the contraceptives.
Okay. So some part of you heard about pills and heard from somebody there were some side effects you didn't like.
Negative side effects.
Okay.
The different implants that they put in, I don't know if it's Norplant or whatever,
Yeah.
they cause all types of reactions to your body that I just didn't want to deal with.
Okay. So, so you're finding out about some methods. We definitely implants, we do that, and pills. But, one of the things I like to talk about is there are many different options. I guess, what do you think about any advantages of even talking about contraception? Do you see any good things about being on contraception?
Well, good things?
Yeah.
Well, I guess it could prevent pregnancy, but it just wasn't something that was important to me.
Okay.
To use contraceptives.
Yeah.
Again, I didn't want a baby. I don't want a child.
Yeah.
But I just never thought of it to be important to me to use the contraceptive.
So some part of you saying, I don't want a baby. I'm going to be footloose and fancy
Oh,
free.
absolutely.
But not sure about contraception, or some part of you said those side effects.
I'm not sure about it. Just not, didn't want to deal with it.
What have you heard people do who want to achieve the goal of footloose, fancy free, no children, that you and I should talk about? What options have you heard about?
Well, there are condoms
Yes.
that can be used.
Yes.
I think that's a pretty safe method.
Okay.
And, or abstinence.
Okay. Absolutely.
That's a better. That's a better.
Absolutely. So those 2 great options.
2 great options.
Abstinence is going to give you 100%.
100%.
100%.
Yes.
Condoms very effective and have some added advantages. What condoms prevent pregnancy
And disease.
and disease. Exactly.
Absolutely.
So you talked about implants and pills, and there's some consequences in abstinence and condoms. Any of those feel right for you right now, for you and I to talk about? Any of those choices, something that you'd like to consider?
Well, the condoms, they do prevent disease.
Yeah.
And that's most important to me, the disease.
Okay.
To be able to prevent disease or infection or
Absolutely.
anything like that.
So some part of you knows about some disease. What have you heard? What don't you like about?
About disease?
Yeah, what have you heard is out there, I guess I'm wondering.
Oh, wow. Oh, my. There's all types of diseases out there. HIV, AIDS, syphilis, gonorrhea,
Wow.
chlamydia,
Yeah.
herpes. Wow. Claps, whatever that is. I don't know much about it, but whatever that is.
Can't be good.
Can't be good. Can't be good. And we don't want those.
Okay.
And there's something called the blue waffle that I heard of recently. Have you heard of that?
No.
Some horrible disease.
Okay. So for you, finding a method of contraception and keeping diseases away. Okay, okay. Well, what do you know about condom use? I mean, where do people get condoms? How do people use it? Have you used condoms?
I have.
Okay.
Well, we have used condoms.
Tell me
in the
about that.
past. Well, you can actually get them from your doctor,
Yeah.
from your health provider. They provide condoms for you, or at the drugstore.
Okay, okay. So you've had use in the past.
As a female, I always have condoms.
Okay, okay.
You would normally think that the male would provide the condoms, but I always have condoms.
Great. So you are sort of doing some good thinking. You are taking charge
I am.
of your health. Great.
I am.
Great. Okay. So having condoms is going to prevent disease. Very effective.
Very
When
effective.
used every time
Every time.
to prevent pregnancy. Good, 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 good. What makes it hard to use condoms? I guess what I'm wondering is you've had some success in the past. Have there been any times it's been difficult that you and I should talk about?
Yeah, because he didn't always want to use a condom.
Okay.
That's the only issue. I've 100% always have been for
So
the
you
condoms.
like it?
Yes.
Okay.
It's necessary for
Okay.
me.
Okay.
But the male wouldn't usually want to use a condom.
And your current partner? Mm-hmm. His feelings?
He feels whatever I say is what he goes with. So he's okay with it.
Okay. So if you were to talk about next steps for you, in terms of meeting your goal of not having a baby, getting on track to
Getting on-
California,
Oh,
and
yeah.
Footloose and Fancy Free,
Yes.
next step would be what?
My next step would be to attend college.
Okay.
I've just graduated from high school,
Great.
so I'm going to college.
Great. Good. And so it sounds like for now, finding some way to not have a
Yeah,
baby,
baby. Oh,
to
yeah.
bring to California, to Footloose and Fancy
I
Free,
can't take a baby to
didn't
California
involve.
with me.
Okay. Okay. So if you were to talk about a goal to avoid that, avoid bringing that baby with you to California and Footloose and Fancy Free, what's the goal going to be?
I definitely say those condoms.
Okay.
Just keep using the contraceptive
Okay.
condom.
Okay. Okay. All right. Well, I've got a bag, probably a dozen or so that we have for free to take out of here. Do you need some now to take
Yes,
away?
absolutely.
Good.
Thank you.
Good. Absolutely. So let me do that. The other thing, just so we're clear, Alicia, you can come back and check in with me on how these are working for you.
Okay.
I heard you saying the other methods weren't right for you, and that's fine. I guess what I would say is I've had some women say that these other methods have some advantages, like he doesn't have a say in it. You get to, particularly with some of the longer methods, put it in and not think about it for a while. But why don't you think about it, maybe talk to some of your colleagues, see what your girlfriends think. But for now, I've got a set of condoms here.
Okay.
I'll send you home with those.
Okay.
And if there are questions about other methods or other things you'd like to come back and talk about, I'll put my card in the bag and you can call me or make a follow-up appointment. Would that be
That'd be great. Thank
good?
you.
I'm glad you came in.
Thank you.